Hello, my name is Bonnie Moon. This is my stakeholder education plan for my clinical scholarly project. And my clinical scholarly project is on education for advanced practice registered nurses on diet planning, specialized diet planning for their obese patients. So basically, my nurses will be educated on diets, on allergy testing and intolerances, and how to make a specialized diet based on those intolerances for their obese patients. And then they will be questioned after a 2-week period if it improved their ability to cause a change in education for those patients. So I am a registered nurse and I am owner of Life Drip, which is an IV hydration and vitamin therapy business. It's completely mobile, so the clinic delivers the care to the patient's home, hotel, or office. And so the stakeholders involved in implementing my change are going to be, first of all, myself as the CEO and my medical director, my investor, and the APRN nurses, the nurses that are going to be delivering the care to the patient's homes. And so my medical director is a medical doctor, and basically in California, as a registered nurse, you have to have a medical director that's a doctor. And so he would essentially have to make final decisions for practice changes, especially if they involve prescriptions. So my investor, if it's a change that needs money, he would need to be involved. And so in the later stages, he will have involvement, but for my CSP, he will not. And then the nurses are the biggest stakeholders in the change because they're going to be the ones that are going to be implementing the practice change. So the educational needs are going to be from my medical director. He already knows, he's well versed on food on allergies and intolerances. And so he will definitely approve my practice change. My investor, again, he doesn't need to improve unless I need to get equipment. So when the practice change leads to me needing to have my own lab and blood testing equipment, and if this practice change is very successful, we will do that, and so we will be able to save money, so we won't be sending the patients to the lab. And so basically, the nurses are going to be the biggest stakeholders to have in education. So basically the theoretical and conceptual framework behind my CSP and intervention is basically foods that cause inflammation in the body, specifically in the gut, make you vulnerable to weight gain. So if you avoid foods that cause inflammation, then you directly avoid the inflammation in the gut and the weight gain that can be caused by that. So we are finding that the same diet for each person doesn't work. So we're getting into specialized diets for patients, and this is a good start, testing to see if the person has a food intolerance. And so basically you would test the blood, and you would take a blood test, and they would test for IgG and IgE. So I have a little excerpt here from one of our clinic books. It says, not all clinical practice guidelines that are published follow rigorous methods in their development, which is why critical appraisal of guidelines before adopting them and implementing them into practice change is necessary. So basically what that means is, as a CEO, I can approve anything, and I have to make sure that it is evidence-based practice that has been critically appraised, and it's from a very good study, and it's good evidence to be used, and has been rigorously tested. So it's very important for me to keep that in mind when I'm implementing practice change. And so I know that changes the diet can reduce weights in patients based on numerous studies. So I already know that. And so my continued research has really been focusing on the positive IgG and IgE results that that cause the inflammation. And so my plan for this is going to be to mostly implement the change to my nurses. They will be the drivers to this change. My medical director does not need influencing. My investor will need education when later. And so, first of all, I will set up an education day, and I will construct an educational / demonstrational meeting. And it will go over all of the proposed change for the CSP project. I will educate the nurses on a healthy diet, how to talk to the obese patients, because most nurses, first of all, are obese. And second of all, they have an uncomfortability talking to their obese patients. And so then I will educate the nurses on food allergies and intolerances, and blood testing, what tests to order, and how to read those allergy markers in the blood tests, and then how to make a customized diet plan based on whatever foods show that they have allergies and intolerances to. Obviously, I will have the nurses make a diet plan that excludes those, making sure that the patient avoids those foods. So then I will also demonstrate a mock patient trial. I will have some patient come, and I will demonstrate from start to finish on how to talk to the patient in those sensitive issues, and how to make a diet plan, and how to tell the patient, how to educate them, how to ask them questions, and how to get them comfortable, and just breaking through that the cultural stigma that we think that we cannot talk to people if they are overweight like it's a socially unacceptable. So it shouldn't be, especially since obesity is the second most preventable cause of death in the United States. It should be a topic that we are very comfortable talking about. So anyways, thank you so much for watching my video and listening to my CSP intervention and my proposed educational plan to my stakeholders. Thank you.